I'm Dr. Tim Maggs. I specialize in the diagnosis and the treatment of sports injuries, primarily with the middle and the high school population. I've been doing so for the past 25 years with our Concerned Parents of Young Athletes program, and I've enjoyed every minute of it. But there's one condition in particular that people need to learn about because so many docs and so many therapists and so many coaches and parents are unfamiliar with it. Yes, yet it's a very prevalent condition, and it's a version of the spondylolisthesis condition. The name is not really relevant. It's a pre-fracture and a fracture in the low back of young athletes, and it's governed by two things. One are the biomechanical imbalances. No human body is symmetrical. So we're born asymmetrical, and our program is the only program that looks at those asymmetries and does those things needed to balance the body, which is a huge difference compared to the reactive, localized sports medicine industry that is out there today. So the biomechanical imbalance is the first contributor to this condition. The second contributor is overuse, which we know this population is being overused because they're overplaying and their schedules are absolutely insane. When you have a young female softball player playing 7 games in a weekend, the body can't tolerate it. So the combination of the imbalances and the overuse in the low back causes that low back to become injured. It starts out as a strain sprain. It's the muscles and the ligaments. Then the inflammation goes to the bone. And then because inflammation in the bone weakens the bone, it then fractures. It's a stress fracture of sorts. It starts as back pain, and then you have to know what to do test-wise once that young athlete has back pain, and this is where so many of our providers are ill-equipped. So we have questions and answers on our website. Go there, or you can always contact our office, and we have a program available for parents to be able to talk to me directly. And you need to know exactly what to do, because if you don't do the proper testing and don't do the proper treatment, then that young athlete is the victim of pain and suffering that is not necessary. So we're looking to get this information out there and get through the proper tests and the proper treatments ASAP, and then come back to where you started and say, let's look at the schedule of training and conditioning, and let's look at the biomechanical testing that is now available out there today. Let's get kids on a better program so that this condition isn't as prevalent as it is today. So feel free to contact us if you have any questions, but it's a huge issue out there, and we need to do better than what we're doing right now. Thank you. Best of luck.